I am Pamela Stone, and I'm a gynecologic oncologist. I work at the Goshen Center for Cancer Care. I did undergrad at Carleton College, which is in Northfield, Minnesota, and then I did medical school at the University of Minnesota at the Minneapolis campus, and then I did my residency at the University of Iowa Hospitals and Clinics in Iowa City, and then I did my fellowship at University of Southern California. I chose gynecologic oncology to be an advocate for women with cancer, and that includes women with vaginal, vulvar, cervical, uterine, and ovarian cancer. Very rarely a placental type tumor called gestational trophoblastic disease. I am interested mostly in ovarian cancer and managing that with a combination of surgery and chemotherapy. And then I'm interested in robotic surgery, so I promote robotics within our program. The maximum amount of data we have when we see a patient is beneficial. So for a patient with cervix cancer or vulvar cancer or uterine cancer, that's usually a biopsy that gets them into my office. For an ovarian cancer patient, that would be closer to just imaging, and that is most commonly a CT scan. Gynecologic oncologists are just unusual in the world of cancer because we're trained to do surgery and chemotherapy. So we're a blend of medical oncologist and surgical oncologist. At Goshen, however, our chemotherapy is done by medical oncologist. So we work closely with the medical oncology team to coordinate that. The NP typically works with me the most, and so she usually meets my new patients. And that's really to introduce the patient to the entire team so that they know who's going to be with them in the operating room and know who may be communicating with them post-operatively. We have a few trials open at our cancer center, one for women with BRCA1 genetic mutation that do not have a cancer diagnosis, and the trials to look at cancer prevention without harming typically a young woman with menopause side effects. And then currently we have new therapies for maintenance treatment in the setting of both ovary cancer as well as a recurrent and advanced or metastatic uterine cancer. And so those are pretty new and exciting options for those women.